So today is my check-in for my 4-week check-in for my total joint replacement and discectomy with fat graft with my surgeon. I'm excited to see him. He's a great surgeon, and I have a list of questions I'm going to ask, so I will check in soon. Today's the first day I've put on a bit of makeup, so just a little bit, not around my incisions, and I can show you my scar update again soon. Alright, I'll be in touch. Hey, so checking back in. I'm home now and I'm feeling pretty good. My check-in for 4 weeks went pretty awesome. I have such an amazing surgeon and he always makes me feel better, so that's great. The things I want to talk about with my check-in is things went well, completely well. He thinks that I'm recovering great. Anything that I'm concerned about should resolve. So I've made a little list. He thinks that first of all, I have my joint I have is a titanium Leica Smith joint. So for anyone who's asked me that question, that's the joint I have. Now I have to start physio, so I don't get a Therabyte and I have to see a physio. But in the meantime, I have a cheap, cost-effective way to get my physio in. I have paddle pop sticks. So I have to fit as many as I can in my mouth, push up, stretch my muscles for 30 seconds, do that for 5 minutes, 4 times a day. So I'm going to do another video of me doing that because if you are struggling financially or there is something, the Therabyte is apparently very expensive, this is a great way. So next thing is the nerve pain that I have been mentioning. So we have first bite syndrome. So that has, in the last few weeks, decreased from a 20 out of 10 to a 10 out of 10 pain. So I felt very heard when I talked to him about it. I said it was a 20 out of 10 pain, and he just said, yeah, it definitely is. It's excruciating to go through that. So I felt very heard, and that alone made me feel better. But it is decreasing to about a 10 out of 10 with pain for that few seconds. So for me, I think it's getting better, and that's great news. Nerve pain that I am getting, tingling through my face, it is raw up to about here on my joint replacement side, and it is to about here on my discectomy side. So, and then on the sides still feel like hairs are standing up. I took my daughter to a gymnastic lesson, and by 45 minutes was over it. I just, this nerve pain. So he said that's normal. It should take up to 12 weeks to resolve, which I was expecting. So the next thing is now I'm free to eat what I want. So at 6 weeks you can eat, he said that you're free on every diet, but right now I'm free to experiment on what I can eat, not just soft chew diet. I'm finding personally it's hard to chew anyway because I only have 2 teeth that touch since my bite has completely shifted back into place and all my teeth are grinded down, so I need to get that them built up, dental work. But I'm okay with that. It just makes chewing a little bit difficult. But he said I'm free to experiment now on different foods, depending on because my opening is still small, what I can fit in, and what doesn't cause me pain, and what doesn't tire out the muscles so much. So one of the things that can happen is my muscles in my face can tire out quite quickly. This is because in the surgery your muscles were sliced open, so he said bone will heal quicker, and muscle will take longer to heal. So you've had your muscles sliced through, so now it's just taking time. So I find that I just get really tired. What else? So I'm free to eat, and I want to do a video on different things I'll try, and I can let you know how they will go. Now my eyebrow is still not raising. So in previous videos I was making a joke that I'm the Rock, you know, like raising one eyebrow. But it's starting to twitch, so it's coming back slowly. And he wants to see me in 4 weeks. If in 4 weeks I'm still having a problem, he's willing to put some Botox in this eyebrow to make that stop going up. So I just basically don't move both of them for a while. He's also willing to look down the track at doing some Botox in my masseter muscle again. I had that prior to surgery for a long time because of clenching and grinding, but now I still will clench and grind because that's a stress related thing, and he's willing to keep doing that for me, which is amazing. So what else? Yeah, I think that the next video I want to do, he's now told me that to stop using the vitamin E cream and bio oil that I had previously done a video on, and move on to a silicone based gel. So I've got a gel that I can show you, and I can do a video on that. Yeah, there are many out there, and I can just show you the one I've got. So today went really, really well. I'm really happy. He's really happy with it. He wrote a letter to my GP to help with ongoing with my physiotherapy and explain everything that we discussed. I got to see my joint on my skull, the pictures, which was all cool. Yeah, and I feel lighter after seeing him. I think I've generally been more positive after this surgery because of the relief of not being waiting anymore, but after seeing him I feel a lot better. So yeah, I'm gonna do one on the paddle pop sticks and how I'm gonna do my physiotherapy on that. Okay, thank you.